Ladies and gentlemen, the Vice President of the United States, Joe Biden.
Well, good morning. Can you feel the excitement in the room? We're so proud today to have with us the Vice President of the United States. This is our opportunity to publicly express our gratitude to Vice President Joe Biden and to President Barack Obama for believing in our community health centers and for moving forward with the promise of accessible and affordable health care to millions of Americans. And as you know, the Vice President is just back from a mission to Europe where he met with leaders from Poland and the Balkans about the crisis that we're having in Ukraine. So from a personal perspective, we want to make sure that he knows how much that we appreciate his being here. And community health centers love Joe Biden. Throughout his public life, including his 36 years in the United States Senate, he has truly been a man of the people, a fierce fighter whose work has advanced the ideals and principles upon which this great nation was founded. He is a leader who has stood shoulder to shoulder with us in the fight to expand healthcare access and sustain a strong safety net in our nation. Joe Biden knows health centers. And he knows what they mean to our communities and the people that we serve. And from personal experience, he also knows the tragedies and hardships that often befall families through no fault of their own. And he has stood up for the working poor, the frail elderly, and the most vulnerable in this nation. He clearly understands and is a huge advocate for the expansion of behavioral health services in this country. And like all of us, he believes that government has a moral responsibility to lift barriers, particularly for those in need, and provide the opportunity for health, education, jobs, and the chance for a better life in this nation. He also knows government can't do it alone. It's up to all of us is in the room and those in a greater nation, to ensure that we live up to the highest ideals that this country represents. Vice President Biden exemplifies the true meaning of a public servant, and he serves for the greater good. So please join me in giving a warm, warm NAC welcome for a great American and a champion of America's health centers, our Vice President, the Honorable Joe Biden. Thank you so much.
Thank you very much, Doctor. Thank you. We got this backwards. I came to thank you. Thank you very much, folks. It's a great honor to be with you. Please sit. Let me begin by apologizing for my voice. I just got back, as Doc said. I've been traveling around the world a lot, and apparently I acquired a sinus infection. So my doc told me I couldn't do an event last night in New York, which I felt badly about. And I said, and how about this morning? I said, hell, there's 1,000 doctors there. I can be, I'm fine. There's nothing wrong with that. If you guys can put up with my voice, I'm sure glad to be here with you. Thank you again. And look, I mean this from the bottom of my heart. You are the blood and the sinew. You are the moral backbone of this country. You and so many thousands of people like you who who just believe in possibilities and believe that it's one person at a time. You help one person at a time. And so my admiration for you is equally as deeply held by President. Stop moving what's this thing called? You know, teleprompter. Barack always kids and he says, Joe Biden, he said, I'm learning to speak without a teleprompter. Joe's learning to speak with one. But seeing all of you, I really mean it. The reason I'm here and Barack wanted me to be here is to thank you. Thank you so, so much for what you've done, not for us, but for the American people. So many millions of people vulnerable. So many millions of people knowing what they need and having no access to get it. You know, first off, the President and I think you provided an incredible service that you provided this country. Nothing to do with the ACA. Just what you've been doing. It's an incredible service you've been providing. You have more than 1,200 community health centers and 9,000 sites in all 50 states. No, but here's what I want you to think about. Think about what those cities, what those communities, what those neighborhoods would be like if you hadn't been around all these years. I mean, I really mean it. Think of how fundamentally the lives of those communities would be changed without you. Those community centers you run, 150,000 hard-working men and women. Feels like I'm with all of you today. 21 million patients. 21 million patients rely on you all. More than 3.7 million, or about 18% of your patients, are children. For them and their families, you're the first place they go for primary care. You're the first time they've probably ever seen a dentist is because of you. The first time they've ever received behavioral health services. Maybe when they walk through your doors and benefit from your care and expertise, and emphasize care. Without you, the country would be a very different place. That's not hyperbole. Without you, the country would be a very different place. The thing I love about you all, obviously I don't know you all, but I've spent a lot of time in the community. The thing I love about you all is you all, in face of all that you see, you remain optimistic. No, I really mean it. It matters. It matters. You believe in possibilities. You're always looking about what can be better. Why can't we get this, that, or the other thing done? Great things happen when people believe. You know, I have to admit that Doc's right. I served, every time someone says I served in the Senate 36 years, I bless myself. I think, God, I can't be that old. But, you know, during my career, you know, as a lot of you know, we senators and congressmen, we have what we call caseworkers. I had probably more caseworkers than most in one of the smallest states. I allocated more of my staff salaries to people who were the people around the phone or going into somebody's home, trying to help them with things that mattered in their life. I was blessed with so many competent caseworkers who not only believed, but were determined. We're determined to take care of people, one family, one person at a time. It's not some global thing we do. I'm reminded of that. Any of you have daughters that are grown? Raise your hand. Again, I always kid. I have 4 granddaughters, and I kid, and I adore my daughter Ashley. But I always kid and I say, you know, granddaughters are better than daughters. And they go, what? And think about this, all you guys have had grown daughters. One night when they're about 12 and a half years old, you tuck this beautiful little butterfly in bed. And the next morning you walk in, there's a snake in the bed. Dad, drop me at the corner. Dad, don't cheer so loud at my games. Dad, don't kiss me in front of everybody. Dad, Johnny's really a good guy, I promise you, Dad. All you women, you all come back to your dad somewhere between age 20 and 24. In my case, it was 24. But I've got this magnificent daughter who's bitten with the bug that she can be the agent of change that she wants to see happen. All of my kids, all did the wrong things. They all went into public service. And I wondered how the hell that happened. Because now when they put me in a home, I'll have no window with a view. I'll be just, one of them should have gone out and made a lot of money. But my married daughter, who lives in Philadelphia but works in Wilmington, Delaware, runs a non-for-profit for at-risk kids and those being let out of the prison system, trying to work their way back in. And she is like all of you. She really believes that things can be made better. Think of what it would be like if we didn't have all you guys. I'm getting too maudlin about how much I appreciate what you're doing, but I really mean it. You know, this country has always been, the defining feature of this country has been about possibilities. We've always believed that anything's possible. And the kind of work you have done reflects that belief. You know, I've been traveling around the country a lot lately. I've been traveling around the country constantly, actually. And what I've done since the Affordable Care Act is every community I go into, I ask to meet with the advocates. I meet them at diners and coffee shops, and a lot of them come from your ranks. And I've met with moms and daughters. I've met with seniors and students. I've met with small business people, the guys and women who run the diners. And during those visits in those coffee shops, I've gotten a pretty clear picture of why I'm convinced this the Affordable Care Act is going to work. In Miami, recently I met with a registered nurse and a couple of enrollment counselors from the local health center, where 95% of their clients live at or below the poverty line, making $12,000 to $20,000 a year. They said they never thought they'd ever be able to afford health care. And the enrollers never have been more rewarded, they say, than watching the look on a mother or a father's face or a young person's face when you say, you're covered, you're okay, you can afford this. How many stories I've heard and you've experienced where clients walking out of the healthcare center crying with joy that they never ever thought this could happen. But since December, that particular center has enrolled dozens of people a day, and their clients, as I said, are, just never thought this could happen. One of the things we underestimate most, keep that where it is, one of the most things we underestimate the most, to me anyway, it's not, I think, the Affordable Care Act, the single most incredible gift it's given to people is it's given to them a sense that it's lifted a weight off their shoulders about, it's given them peace of mind like nothing else could for them. How many of your clients do you know go to bed at night staring at the ceiling, wondering if, God forbid, they lean over and look at their wife and if she gets breast cancer, what happens? Or what happens when my children get sick? Am I going to be able to sleep in this house the next night after this all happens? Am I going to be able to afford to be here? Am I going to lose my home? Am I going to lose my sense of well-being? And I think the single biggest thing we do is we give people peace of mind. You give them peace of mind. I hear that more than anything else. In Phoenix, I met with community health center workers who were once in the shoes of their clients, denied or dumped out of coverage because of pre-existing conditions or because they reached a lifetime cap. And they personally know what it felt like to live paycheck to paycheck and put the health of their families ahead of their own health. They told me numerous examples that you all know. Helping people enroll at a center was the most rewarding thing they say they've ever done in their careers. They tell me that nothing beats seeing the relief on people's face when they can finally afford coverage for themselves and their families. Maybe for the first time, sleep easy. As I said, it's what I love about you all is that you not only believe in possibilities, these stories that I've heard from Scranton to Atlanta to Minneapolis across the country, they're the reason why you're in it. There's the reason why you do what you do. And look, the thing that always bothers me, Anybody ever thought this was going to be easy, never ever had insurance? Seriously. Assume you're a very wealthy person, you can buy whatever insurance you want. It's a complicated business. It's a complicated business. It doesn't matter whether you have a GED or a PhD. When you get that, how many people do you know who have nothing to do with affordable health? And they come to you because they know you know something and say, I just got this thing about open enrollment. What do I pick? What do I do? And so, you know, if it's difficult for people who have been able to have and afforded health care their whole adult lives, why do we think it would not be difficult for people who never, ever, ever had insurance? Look, it's complicated. So we shouldn't be surprised that it's complicated for people who have never thought they'd be able to have insurance. No matter how good the bargain is, it's especially challenging for folks who are looking at it for the first time. But that's why they're so vulnerable. With patience and empathy, you look these people in the eye. And the first thing you do is you calm them down. The first thing you do, is let them know that there's no reason to be embarrassed that it's complicated. How many people you've spoken to, you can tell by the look in their face, they're almost embarrassed to ask you the questions because they don't want to feel stupid. And I can hear somebody saying, that's right. But you know it. And that's why they trust you. You dispel their fears. You put them at ease. And you walk them through the process. I know it's tedious. And to add to the difficulty, we didn't help you much at the front end here, man. I have my boss, my friend, Barack Obama, is an incredibly patient man. I suggested after going through the first couple weeks I would nominate him for sainthood, that he kept his patience. But, you know, it got off to a slow start. The president and I was as frustrated as anyone you ever knew. But it's basically fixed. And just in the last quarter of 2013, you helped 2 million people in the face of that confusion. You helped them. You helped them enroll. They walked through your doors, or they reached out to you in the community, and you made a difference. You answered their questions. You walked them through the enrollment process. More than 5 million people now have signed up for the private health plans through the marketplace. And many more that we're not even counting gained access through health care by signing up for Medicaid. And ladies and gentlemen, imagine if every governor did the right thing and signed up for Medicaid. I am convinced, as a practitioner of the so-called art of politics, that they all will, over the next several years, they will not be able to sustain the heat. But here's the deal, folks. None of this would have happened without all of you. As I said earlier, the fact is community health centers are the indispensable resource for so many people out there who are underserved and underinsured. You've been the only place millions of folks have been able to go for basic care. And in the process, treating your patients, you have eased many of their concerns and fears about the Affordable Health Care Act. You've overcome language barriers and geographic distances. You've been so successful because people trust you. You're about the most, of all the places in the world to go, it's doctors, nurses, hospitals, you guys, who will look in the eye and say, this is a good thing, let me help you, this is how it works. They count on you. They know what you've done in the past. That's why you are our most valuable resource and why the administration has always valued. It is not hyperbole to suggest we have always valued, never doubted, the services you provided. The President put me in charge of the Recovery Act, which is almost a $1 trillion piece of legislation that pulled us off the brink in the beginning of the administration. We invested in that act $2 billion toward capital financing, operating costs for community health centers, to build new facilities, hire staff, help make more folks get what they needed. We fought so hard for these investments, all in the face of the most god-awful recession in the history of the United States, short of a depression, and that's not hyperbole. It caused millions of people to lose their jobs and in the process lose their health insurance. We knew at the time of the Great Recession, of the incredible uncertainty, and we knew that they'd come to the one place they could always count on, you. That's why in the Affordable Care Act we invested another $11 billion in community health centers. You know what that means. You know what that means on the ground. More dedicated staff like physicians and nurses, renovations you desperately needed, construction or new sites to better serve the community, and expanded primary and preventive care. So many more folks can receive the health care, the medical care, the dental work, access to behavioral health services that you provide. In part because these investments in health centers across the country, you've added 35,000 new full-time workers. You've served 4 million more people in 2012 than you did in 2009. And it's going to continue to increase. It's incredible what you've done, and that's why we believe in you. And you were with us on the day one because you believed, as we do, that health care, and this is an important, I've been in politics a long time. I remember in the very beginning, I was vilified in my home state running by the other team because I thought, outrageous thought, I mean this sincerely, any of you from Delaware will remember this. I said health care was a right. That was an amazing notion. No, think about how far we've come. Think about how far we come. From the beginning of my career, for the first two-thirds of it, there was still another group of people out there, another party said, health care is a privilege. It is not a right. As recently as this last campaign, my opponent and the President's opponent talked about these people, they expect this help. What an outrageous notion. But think about it. It was the centerpiece of a debate just in the last presidential election. But the most incredible thing about the health care bill is that this is the first time in American history we have, at least legislatively, ended the debate. Health care is a right, not a privilege. As I said earlier, you know as well as any group of people the peace of mind that could be restored for millions of people knowing that they have coverage. The result, because of the Affordable Care Act, 105 million Americans have already gained coverage for at least one free preventative service, such as blood pressure, screening, colonoscopies. 47 million people now have access to recommended preventative service, such as mammograms, at no out-of-pocket cost. 129 million people with pre-existing conditions can no longer be denied health care because of this act. More than 3 million young adults, as a consequence of this single piece of legislation, are now able to stay in their parents' health care plans until age 26. It's no longer permissible to have insurance companies cut off services because you've reached your limit. The most vulnerable point in the life of any family, and to be told, sorry, your insurance has run out. Insurance companies can no longer charge women higher premiums for simply being a woman. Pregnancy, ladies, is no longer a pre-existing condition. I mean, think about it. Just think about it. What's already happened. But the point is that you're among the most trusted advocates of the Affordable Care Act because your entire mission has been increasing access to health care and giving folks a fair shot and a fair shake. You understand at your core that change and progress come from the ground up, come from your communities up. And again, I'll say it again, people trust you. And that's why we want you, so we can finish the job. We need you. That's why we invested around $200 million to help train and hire 11,000 staff, to enroll folks, to educate your communities about the new marketplace, including efforts to bridge language and cultural challenges. And you've delivered. You've delivered. But you know all of that already. You see it every day. But if I may be somewhat presumptuous, I want to remind you of 5 things you already know, but we only have about 10 days left in this enrollment period as we head to the home stretch. Number 1, health insurance is about peace of mind, and it gives you a chance to live your life with more security. So when times are tough, you know it won't be an accident or an illness away from bankruptcy. Now, every one of you moms and dads out there should be pointing something out to your kids and all the young people you see who think they're invincible. What I say to them, and I do these telephone conferences with up to 20,000 people and as few as 1,800 people in all communities. And I spoke to a group of young advocates, I don't know how many thousand there were, on the phone, on a conference call. And I said, remind your friends that even though they think they're invincible, they owe it to their parents to give them peace of mind. No, I mean it. A little bit of a guilt trip, but it's real. So every kid you know out there and signed up, remind them, your mother's going to bed worried. You owe her. I mean it. You owe her. When I start talking like that at universities, they go, oh, he's pulling the mom thing on me now. You know what I mean? But it's true. Think about it. Think about it. The second thing I want to say, this is all about choice and opportunity and freedom. I can't tell you how many people I've known through my life, I've known as a public official, and I know today, who tell me they've stuck with a dead-end job that doesn't pay very well. They've stayed in a community that they didn't want to live in, they wanted to move, for only one reason. They have health care coverage. Guess what? They're now free. They're now free to go look for a better job, to move to another community. But look how many people you know who stayed where they were in the job they did not like, were underpaid because they were scared to death. If they moved, they had a pre-existing condition or a number of other circumstances you can think of, they'd be in real trouble. The law gives folks the freedom to follow their dreams regardless of where they live or what they do, because now they will be covered no matter where they go. Remind them. And as I go around the country, the thing I find the most, I hear the most, and when I'm out trying to sell, I don't do it as well as you, the Affordable Care Act. The thing I hear when you break through is, well, I can't afford it. I just can't afford it, particularly from young people. I got my college bills to pay, I got my car, I got my rent, etc., and it's tough for them. And then all of a sudden they realize, my God, you mean I can get health insurance for less than it costs me to keep my cell phone? Seriously. And think of how many very poor people have come in, talked to you, worried that they were not going to be able to afford what, in fact, they needed, and that they would not get any help. When people find out a family of 4 can be making $95,000 a year and still get help, they're blown away. They have no idea. They have no idea. And so the most interesting thing for me is that the ultimate way this is going to work down the road is I'm talking to your neighbor, finding out, my God, you got this insurance? And that's all it costs you? So the cost piece is something you can break down the barrier when you're talking to people. It's affordable. It can be affordable if the state takes advantage of the opportunity to expand Medicare under health care law. It changes everything. Many of the folks that you talk to receive a tax credit to help them buy a private insurance plan and qualify for Medicaid. Many of them could gain coverage if the remaining holdout states take advantage of the opportunity to expand. So in the states that haven't made up their minds on whether or not to expand, we should be pushing as hard as we can without relenting at all. And folks, look, the deadline for signing up for private health plans is through the marketplace is March 31st. There are a few exceptions, but the point of the matter is that we only have 11 days or 10 days left. And the bigger the number we bank, the more certain there will be no ability to turn this back, no matter what happens in the Congress, no matter where this moves. The next enrollment date is in November, and we've got to roll into that date strong. And so this final point I'd like to make to you is remember why you're doing this in the first place. And these last 10 days, push as hard as you can. Expanding access makes a gigantic difference. And the Affordable Care Act, like Medicare and Social Security, is like, well, let me put it this way. It's the single biggest social initiative the country has taken since, even more so than Medicare. More so than Medicaid and Medicare. This is allowing everybody to be able to have affordable health care. So look, let me close by saying that with the grace of God and the goodwill of the neighbors, as my grandfather would say, we're going to come out of March 31st with such a significant pool of people who have already signed up, with the pressure being put on governors who haven't allowed their states to take advantage of the Medicaid coverage, that we're going to roll into November in a situation that many more people understand intuitively what this means. Many, many fewer are afraid that they can't afford it, and we're going to see this thing continue to roll. And so you're the ones who fuel that progress. And all I'm saying to you now is, it's an unfair thing to do, is ask more of you. Push as hard as you can these last 10 days. The higher the numbers, the more certitude this is going to last forever. And ladies and gentlemen, this is one of those experiences, and it sounds corny, that you're going to be talking about with your grandkids and great-grandkids that you were part of. You were part of putting in place that's something that 20 years from now everyone's going to wonder, what's the big deal? What's the big deal? Doesn't every country do this? So ladies and gentlemen, let me conclude by saying for the 15th time, not only do we need you, not only have you done an incredible job, but we owe you more than we can possibly pay you for doing so much as you are for the American people. Thank you very, very much for all you do.